Monday, Tuesday, Wednesday, Thursday, bad, had bad days too. Friday, Saturday, Sunday, bounce back, high, bad, always do.
Hello and welcome to another voiceover. So for today's video, I thought I'd show you what labor and delivery nurses actually do during their shift. Obviously, every day in labor and delivery is different, and that's really what I love about being a labor and delivery nurse. But one of the things that are the same from day to day are me grabbing clean scrubs and changing into clean scrubs. Then after getting a report, meeting my patient, writing our daily goal, which is usually to meet baby on their board, and then cleaning down my station. And when I clean my station, I literally clean everything to the point where one of my coworkers asked if I was okay. And at this point, if my patient doesn't already have a peanut ball, I like to grab one for them just so that I can help rotate their baby and facilitate their labor. Like I mentioned, every day is different. Sometimes I'll have an admission, sometimes I'll jump right into an epidural, sometimes I'll jump right into pushing with the patient and having a delivery. On days I start off with admissions, I just like to get the room ready, have all my IV stuff prepared, and just kind of make the room more welcomeable. Is welcomeable a word? Welcomeable. Anyways, with a lot of our inductions, we like to do Foley balloons in our hospital. Like I mentioned in one of my TikToks, if you watch my TikToks, I wouldn't wish a Foley balloon upon my worst enemy, but we still do it in our hospital. And honestly, Foley balloons help a lot at opening up a cervix, so I don't really mind them in that sense. But I still think they're very barbaric and painful. A lot of the shift is spent grabbing meds for our patients as well. In labor and delivery, we use a lot of Cytotec, pain medications, lactated ringers, antibiotics, and Pitocin. My favorite med to prepare is definitely antibiotics, just because something about mixing it is so satisfying. It scratches my brain. Oh, I also forgot to mention the topicals. We use a lot of benzocaine spray and witch hazel for postpartum. Another thing that we do a lot during the shift is assess fetal heart tones. So we're always watching babies' heart rates from outside at the nurses' station. One of our nurses used to say that you'd think it was like the most entertaining game ever, and that we're all just watching TV on the unit because it's on every single screen and everyone is always watching. On days where I have the time, I like to make them little baby hats. If you've seen my TikTok, you know I'm obsessed with the bear hats as well as bow hats. I feel like I really should learn how to make different kinds of hats because I want to surprise my patients sometimes with something that's not a bear or a bow hat. I actually had a patient the other day who was very familiar with bear hats, so I need something that's a little more surprising. Here I am setting up the baby warmer, and also if I have time, I like to clean up after the delivery. On days where we have C-sections, I like to wear my own scrub cap. So here I'm wearing my Studio Ghibli scrub cap and just kind of getting ready for my C-section. This is just a quick little sneak peek of our operating room. This is where the patient lies, our sterile stuff, the anesthesiologist is right by the patient, and the support person is here as well. The drapes go up so that the patient can't see anything, and then the surgery all happens down there. On days where I have triages, a lot of times we send urine samples because a lot of people come in with like UTIs or like some type of infection. We also have people who we have to send down like protein creatinine to rule out preeclampsia. We send a lot of urine down to lab through the tube station. On days where we don't really have a lot of patients, I like to just kind of catch up on any education that I need to have done and just kind of relax and keep myself warm because the hospital's very cold. Okay, anyways, Thank you so much for watching. I'll see you in the next one. Let me know if you like videos like this. Bye!